Yes, we are continuing our series of lectures on tuber factor infertility. For patient that has tuber blockage, what are the options that the patient has? Initially, before the advent of in vitro fertilization, some of the procedures that were done include what we call hydrointubation. Hydrointubation, what people conventionally refers to as tuber flushing. This involves using some materials, injecting it into the uterus, then into the fallopian tube to create patency in the tube. But however, the success rate was low. Can it still be recommended today? The answer is yes. It's worth giving it a trial because it's cheap and has been found to be useful for treating perifemoral adhesions, especially in the distal parts. Another procedure that we can do for a patient that has bilateral tuber blockage is tuber surgery. Tuber surgery is a therapeutic option to restore the chances of spontaneous pregnancy in case of tuber infertility. The outcome or the success rate are related to the size and the extent of tuber damage. Proximal occlusion sometimes can benefit from tuber catheterization. This includes, and this ensures that pregnancy rates following tuber catheterization after about 6 months is about 27%. And these have been found to have an advantage over in vitro fertilization. The advantage is that it restores natural fertilities. Other factors that may affect the success rate of tuber surgery will include the type of tuber lesion, whether it's proximal, distal, the availability of qualified surgeon to be able to carry out these procedures. Let me say here that hydrosapigensis, which is accumulation of water within the tube, is associated with lower pregnancy rates, with higher risk of ectopic pregnancy even after surgical repair. Note also that surgically treating hydrosapiens before in vitro fertilization seems to have a positive effect on the chances of in vitro fertilization. Let us now look at, for a patient who has bilateral tuber blockage, we urgently need an IVF. If, for instance, he has had hydrointubation that failed, he may have done surgery that failed, or he has a very poor prognosis couple, or when there are other factors of infertility like hormonal issue, male factors, this patient will benefit from in vitro fertilization. In quick summary, for a patient that has bilateral tuber blockage, they can benefit from hydrointubation, they can benefit from tuber surgery, and lastly, the most common thing that we do for people that have bilateral tuber blockage now is IVF. My name is Dr. Ede Dokolo Osazua, the only doctor of hope.